For pediatrics in a medical setting, most of the children are facing goals of decreasing anxiety because some of the children are in a new environment, such as hospitalization, which can be increase anxiety, as well as if they're being diagnosed with a new diagnosis, that can also increase your anxiety, as well as being separated from family. Like you have families that come in, stay for only a couple hours, and they have to leave, or some families can stay, but that can also increase anxiety, and also depending on if they're having a medical procedure being done. So music therapists can come in and help through music by reducing some of that anxiety that they might have during that procedure, during that time in their life. Another common goal for children in the hospital setting is also for pain, decreasing pain. Depending on the treatment that they're there for or the diagnosis they have, they might be experiencing a lot of pain, and that music in its sense can help relieve some of that for them. And some of the music that can help those two specific goals are relaxation music, either through guitar or other small percussive instruments that music therapists can use to help them reduce their anxiety or reduce some of the pain that they might be having. So that is one way that those needs and goals can be addressed. So my lullaby song that I wrote lyrics for are piggybacking off of the song Lullaby and Goodnight. Here it is. You are brave, don't be afraid. Think of your happy place. You are safe and full of grace, loved by all you adore. Breathe in deep and breathe out. Relax your sweet head. Breathe in deep and breathe out. Your body still and calm. So some things that I did with that song is obviously I picked the strings instead of strumming them. I felt that that gave more melodic melody to the song. Also picking a familiar song that they used by Lullaby and Goodnight, and then changing up the lyrics to something that they could relate to, whether they're dealing with a medical procedure or they're just needing that extra inspiration to help them get through whatever they're getting through by being brave. Another lyric that I put into that lullaby was breathe in deep and breathe out. So that was the music therapist for me, giving the cue to the patient to be able to remember to breathe, taking nice deep breaths in and out. That's another important quality to have when you're playing relaxation music for patients, either they're dealing with pain or dealing with medical treatment. Having that nice deep breathing in and out, and using those breathing techniques with the music and incorporating that in the lullaby as well, so that way the client is reminded to breathe throughout the entire song while they're listening as well. And also being able to be in a comfortable key, song that they're familiar with that has different words. An adaptation you can use with this lullaby is if the patient is good at songwriting or wants to change up the lyrics into something that fits them or their personal struggle that they're dealing with at the time, they can do that as well and change up the lyrics, something they can relate to a little bit more personally as well. And that's it.